Good afternoon. My name is Whitney Witt, and I am the inaugural Dean of the College of Health at Lehigh University. I am so excited to welcome you to the third in our ongoing Population Health Colloquium Series. The Population Health Colloquium is a faculty-organized series that will continue throughout the summer and focus on COVID-19, examining the most vulnerable populations, social determinants of health, and shining a light on long-standing health inequities. I'm delighted to introduce you to Dr. Hyun-Yuk Choi, a professor at Lehigh's College of Health. As a scholar, Dr. Choi is a leading international expert on the effects of air pollution and adverse perinatal outcomes and early childhood asthma. So we're very pleased to have Doctors Mariani and Capetti here with us and to talk about COVID in the trenches in Italy. So I'm going to turn it over to Dr. Choi. Thank you so much.
Thank you so much, Dr. Witt, for the kind introduction. It is not every day that we get a chance to have the opening act by a superstar. But when Dr. Andrea Mariani found out that we're hosting Dr. Amedo Capetti, he was extremely eager to have a chance to introduce his lifelong friend. He believes that the friendship between he and Dr. Capetti has been a life-sustaining force. So he insisted on taking part in this, and we're just extremely honored and privileged. Before we move on, I also have to acknowledge the fact that this webinar would not have been made possible without the extremely hard work of our team within the College of Health, including Ms. Sherry Buss, Mr. Jason Siegel, and Ms. Claire Sipser, and last but not least, Ms. Jeannie Cassis. So with that introduction, I will turn it over to Dr. Mariani to introduce Dr. Capetti, as well as to deliver the first two questions for us. Dr. Mariani.
Yes, thank you. Thank you. First of all, I'm thankful, especially to Dr. Witt and Dr. Choi to inviting me here, and I'm very happy to have the possibility to introduce my friend and colleague, Dr. Capetti. So it's a situation of uncertainty and vulnerability. People are dying. Actually, my mom died in a nursing home in Italy. People are losing their job or are being furloughed. Even in my workplace, there is financial uncertainty. People are blocked and need to stay at home. You cannot see your friends and family. In this uncertainty, either we close with fear and protect ourselves, or we listen and look. We pay attention. Life is telling something to us. So this may be an opportunity to open our eyes and recognize what is important and we take for granted. For example, there is more time for ordinary things, home, family, normal human interaction. If we accept the invitation of life, this situation of uncertainty is also the opportunity of recognizing who is in the life journey with us, who are our friends, who can help me live my life intensely, to stay in this position on being open to what life is telling me. So if we pay attention, we can look for people who are greater than fear, who demonstrate a victory over fear. And so, looking around, we see Dr. Capetti. Dr. Capetti, we were in medical school together. He was taking care of HIV patients. And so we spent a lot of time together during medical school. And then I came here to the United States, he stayed to Italy, but I met him again. And especially, it was interesting for me 2 years ago that I was during the summer in Italy. And I was in this big event, it's called Meeting in Rimini, and I saw a man, and initially I didn't recognize him, but this person attracted my attention. He was taking care of a child. Probably, it seems to me, from distant, a kind of disabled child. He had some difficulty walking, but the way this man was taking care of this child attracted my attention. There was something there. And then I recognized it was Amedeo. And so from HIV to COVID, now Amedeo is taking care of patients with COVID, especially during the last few months. And he recently wrote also a moving letter to an Italian newspaper. Amedeo was licensed in medicine in 1989. He's specialized in infectious diseases in 1993. And then, as I was saying, he took care of HIV-infected patients in an hospital in Milano. And then he has been responsible of the research and development sector of the first division of infectious disease in the University of Milano. He is also a technical consultant for the Holy See at the World Health Organization in Geneva. He is married to Maria. He is a father of 4, two are now physicians. Since 2005, they had 13 fostered children, 2 of whom are still living with them. And so I would like, first of all, to welcome Amedeo. And again, with Zoom meeting, it's difficult to do an applause, but I just invite everyone to do it. And I will start with our first question for you, Amedeo. Amedeo, please take us through a sequence of the pandemic as you experienced it. What was your primary role within your hospital before COVID, and how did it change? So just to give people an understanding of your work and what you do.
Right. Perfect. First of all, let me thank you, everyone, for this opportunity, and especially Hunok, who really believed in this since the very beginning, and especially for what she said about this friendship, because I really would not like this to be an impression of my person. My person is nothing particular, but this friendship, which is the friendship with Andrea, is a kind of friendship when you always look at your friend and learn from him, and it moves your daily life. So this is the first introduction, if I can say, and this is with many other friends all over the world, and with many other friends here in Italy, close friends. So this is I mean, it's not all, but it's really the way all which you will hear touches my life. Okay, so the first thing is that yes, well, I've used, if you've heard, I've worked with the WHO, with the Vatican representative, and so I was there in the beginning of February. They had the executive board, and I was listening as everyone while my hospital was checking, especially Chinese subjects coming from China. uh, I was there attending meetings where we said that the problem was a Chinese problem. So don't worry, don't close, just beware of temperatures at the airports and so on. And so really, I heard that there was a lot of fear around, but I was just saying, well, this is, what is officially said here, and I have no reason to doubt this. So I came back to Italy, checking every day how the situation was going down, and say, well, be calm. There's no need for for being afraid of that. And so Friday evening, I was told from my colleagues that sorry, just a second, I closed my telephone, that there was a man coming to our hospital, probably a probable case of COVID, an Italian man. And but I teach physiology to nurses, and I had an exam. So my first worry was that exam, because I wanted that my students could pass that exam. It's not easy. It's one of the hardest exams in their career. So I went to another part of the town, and I stayed with them for 4 hours. And I was very happy at the end, because they were really good and they all passed. And I came to my car, and I opened my telephone, and I had plenty of calls, and everyone knew a lot more than I. So they were all asking, what's happening now, what's going on, and so on. So I started checking our regional health control, and they had at the beginning a very good way of tracking. So we could track everyone who got sick and understand exactly how things were moving. But the following day, already cases were too many, and the tracking system collapsed. So we had informations only by the media. And I was really angry, because I said, it's impossible that a doctor answers to people from the media, because we know that the media can tell very approximately the truth. When it touches us, we can see a lot of, of sides that are exaggerated or diminished, but they do not correspond exactly to the truth. So, and it's nothing scientific. So I was very angry. At that time, I continued my job, because no one had asked me to stop it. But one night I met with my friends, and they saw that I was so angry, and I asked my professor to tell me, because he is still very much involved in the decisions in our region. So please tell me what's going on, something that I can tell my friends, and then I will stop. I won't tell anything more, because I cannot say what I don't know. And so he said, well, there's a part of our region that will be shut down, and that's all. Okay. And so they saw that I was so angry, and one of my friends said, well, but what does this have to do with the verifying your faith? what is worthwhile now, and what is not necessary. And so I said, well, you're right. What I say to my patients normally is that when they come and they say, well, health is everything, doctor. Well, when there's health, there's everything. And I say, no, you are really wrong. You are going on a wrong way, because health is just a gift, first of all, and it's something that allows you to do something in life. But the more I go on, the more I also believe that it's even not necessary, because you can do a lot of things if you are healthy, okay? But first of all, I say, as a doctor, sooner or later, you will lose your health. So that's the lost battle. The real battle is to open your eyes and see you are in this world because someone has put you in this world. So the most interesting thing is to try to ask yourself who is wanting you in this life, and why, you know. And I mean, it can sound a bit abstracted, but as I said before, inside a friendship, you can start feeling that these are not only words. And most of my friends, of my patients did. So I have, as Andrea said, I'm taking care of HIV infected patients. And in this particular period, this is quite a suffering because I cannot follow them as I did before. But with a lot of them, we have become really friends in this. And they have started understanding that really health is not all. And so I said, especially in this moment when health is so undermined, this is particularly true. Okay, so I want to show the people around me that there's much more than health. And after a few weeks, my professor said, okay, the outpatients clinic stops. So stop with HIV, stop with sexually infected transmitted diseases, stop with HIV-related research. Others will go on with very slow pace and no new trials, because we won't have the energy to follow new trials. We are restarting now. But and then you go up to ward with all the other doctors to take care of COVID patients. And yes, my first impression was quite strong, because I saw all these people who could not breathe. Their respiratory frequency were very, very, very high. You would say 26 to 30, 32 acts per minute. And I said, well, this is the first parameter that I would look at. And our RCU doctors also, I saw that they were really following the mechanics of these patients, because you can say a man can breathe that way for a week, but he cannot breathe that way for 2 weeks. So sooner or later, he would go to exhaustion of respiratory strength, you know. And so yes, we learned a lot every day, and I involved my children, because my two elderly sons, the first and the second, are graduated in medicine. So I asked them, and I asked my students also, to try and look around for any possible chance of care for HIV, for COVID, and to look at all the mechanisms, a lot of things that we did not knew before then, because the news from China were really scarce, I would say. We knew something, but a lot we learned on the field. And from some manifestations at the beginning, we said, well, that's got nothing to do with COVID. And then we learned that they were really the patterns of COVID. And I don't know if I answered, but well, one thing more is that I found in Ward an incredible unity. My colleagues remained for much longer than they should, in Ward to take care of patients until midnight normally, or they came back very early to check if everything was going well. And they had a lot of time, they had decided to spend a lot of time giving news to relatives, because the families could not see their relatives. So that was very, very important. And so I saw something new in my colleagues.
Thank you, Amedeo, for your answer. And I'm always struck by when you tell this about that health is not everything. And because really it's a sign that our patients need much more than just health. They need health because obviously if we don't take care of them, we are not doing what we are supposed to do, but they need much more. They need a meaning in their suffering, in what is happening. They need a company on the journey. And so, and every time, even from the last time I heard you tell me this, I always think about this when I see my patients. What would Amedeo do? No, but it's true. I just think about this. And for example, the other day, one of my patients had on just a little jewel here with the word hope.
Yeah.
So we started to speak about that, about how they need hope, they need a meaning, they need. So even in suffering, there may be hope. So. Can you tell us something about your experience about this particular? So because there has been a loneliness, despair with COVID, but so how do you approach your patients and their hope in suffering?
Yes. So I think there are two aspects in this. The first is that, yes, it was really loneliness and for many despair, because after they came to hospital and they had, our rooms are, well, in each floor we have, let's say 5 or 6 single rooms, and the others are all double. So if you finish in a double room and your companion is on a helmet, or he's breathing very badly, and one night the ICU doctors decide to bring him down to ICU unit, and you start breathing badly, you feel that you are on the path to dying. Okay, so I have seen a lot of despair in this. Well, and a doctor must be, as you said, at your side. You may not know, but I want to tell you one thing. After that encounter with Andrea, we found ourselves again on the tracks of a very great doctor, who is Giancarlo Rastelli, and he was pediatric cardiac surgeon, right, at Mayo Clinic. He came from Italy, and he died very, very young, but he made a lot of discoveries, and in particular, he was, I can say, a one man every time I read of his life, and his story has changed a lot in my life in 2 years. More friends, but in particularly, as Andrea said, you know, when you are on your job and you say, well, what would he do in this moment? And so the one aspect is that the way you stay there, it's nothing, it's not a strategy, it's nothing that you invent at that moment, it's something that you find on yourself. So the way I was there was, how can I say, a happy way. It sounds strange, you know, because you say you are in the middle of despair and you move like a clown, you joke, and everything is a source of joke with the patients. But you also discover that the patients want that joke, that they want that, because that joke is not, it's looking at them, it's not jumping them, you know. And so on, also the students who were with me, they were involved in that, you know, in the fact that just a few words and things were really often a joke. And so yes, so it's still like that. I mean, this morning I had a very funny idea because now I'm following post-COVID people who has been dismissed from our hospital, and they are recovering, but they are not recovering all very well. And in particular, some of them still have positive swabs, so they are still quarantined, and they can have 7, 8, 11 positive swabs, and they never turn negative. So it's kind of despair for many of them. They are quarantined since the beginning of March, so 3 months, it's really long time, and they want to return to their job, to see their children, and so on. So yesterday I was moved by a friend who is in this situation, and I said, what can I do? So this morning, going to hospital, I said, well, what do we use in our rooms to sterilize them? Hydrogen peroxide, how do you say? Peroxide? Okay. So can you use that in the nose? Because when I go down with the swab, I know that I will fish the virus. So I have to sterilize that part. Okay. So, because now the CDCs of Atlanta and the WHO, they are all saying that after some days you are not infectious any longer. But there's really not a lot of evidence to say that the single person is not infectious. So people are worried. They say, well, but if I may be contagious for my children, what should I do? Or for my father and mother or grandfather? And so I said, well, let's try with the hydrogen peroxide. And this morning, I put 4 ml of hydrogen peroxide in my nose to see how it was. Okay, so it was not so bad, a bit burning, but nothing worse. So to my friend, I said, okay, try that, and then I will put your swab in, And so this afternoon, she had finally a negative swab. And this afternoon coming back, I said, okay, tomorrow morning we will try with cocaine, because my patients sometimes offer, doctor, do you want something good? No, absolutely. How can you think that? So that's the way, and it's something that is part of your life. Your life is happy, and you want to bring that to everyone. So I think that this is a way. And personally, also, because it's not just, I insist, it's not just something stupid. It's that the first thing is that 11 years ago, my mother died, and she worked in health. She was a biologist, and she was affected by a tumor that she had studied. She had also published on that, so she knew exactly what was going on. And sometimes she also made diagnose on herself because she was checking at the microscope herself, you know. So she said, well, how can I say that that doctor is wrong, because he's saying they are inflammatory cells, but I can see that they are that's my tumor, you know. And well, following my mother, I could clearly see that life was not stopping there, and she was not stopping there. You can feel it, because you can feel that it's impossible that such a beautiful thing can stop there. And you really feel after that that it has not stopped. Well, I won't go on telling you how, but I'm sure that before, my mother was at her home. Now she's all around me. So this is also something that I constantly live. And I know that for many, they can understand that their mother or their father has never left them. So when I see someone who's going to die, I can really verify that it's exactly the same thing. He's not disappearing. He's just, you know, going to meet something bigger. What I was saying before, you know, who wants you in this world? So if that is the moment you are going to meet the person who wants you in this world, it's a mysterious way, but it's the most important moment in your life. And sorry, Andrea, I speak a lot, but my HIV infected patients taught me that, because in recent years shouldn't say I lost, but anyway, let's say 5 died, mainly of tumors. And the way they died and the way we shared together all the period before their death is something beautiful, really incredible. Very, very dramatic, because when you get home and a patient says, "Doctor, I cannot undergo the bone marrow transplant because I'm not no more a candidate, and so I will come to your hospital to die," you know, and he dies a few days before his son performs his most important exam in his life, and you have to tell his son, "Please, you must study. You don't, you know, you can go home and don't stay here. Your father will not die today, but you must study because your father really wants that. He wants that you go well, you know." And it's something really moving, but it's not something sad. It's something beautiful. So at that moment, with those patients, I saw the same thing. I was worried that they would die alone, and that they would die, as a Christian, without sacraments. So I insisted that a priest could get in and, if they wanted, administer their sacraments. And also I saw that, as I told you before, all my colleagues were very, very concerned of giving news to the families and, you know, not leaving their patients alone. So I may stop here. If I answered, I don't know.
Yes, thank you. And now I let, thank you, Amedeo. And
Enoch.
I let Enoch continue the conversation.
Wow.
You are
Thank you
muted.
so much, Dr. Mariani, and for your answer, Dr. Capetti. I was struck by one of your comments, and it goes back to the same idea that you wrote about in your letter to Il Folio, the newspaper. And that is right now in US, so many of our young people are feeling angry at their helplessness and are scared of uncertain future. Many of us feel like we're riding a rough storm in an rudderless boat. So according to this argument, happiness depends on the sense of security provided by the circumstance.
Yeah.
In contrary, what have you learned from your experience so that our students could draw from your experience as to how we could deal with and even overcome, all these unexpected blows that the life deals with us?
Yeah. Yeah. Well, it may sound stupid, but I think that in Italy, we also had the relative lack of having lived all this in a period where we had such a beautiful spring as I think we had rarely seen before. So we had also this absolute contrast between what nature was doing on the one side and what it was doing on the other side. Because this brought more clearly to the fact that we don't really possess our life. I'm sorry, but probably this is much American idea, but it's also very eradicated now in Italy, and I think in the whole world. But we don't really possess our life. And it's the same thing about health. All these things are not our richness. And I think what I insist is that this is true. Following all these things that we may lose one day or another, we lose our life. We lose, really, we may arrive to 60 years, 70 years old, and then say, what did I do with my life? No, and this would be really dramatic. But this COVID came and just rubbed everything off. So we found that we were really miserable. A lot of people lost their work, their jobs, and also our health was really at risk. Also because when at the beginning we heard from China, elderly people, we said, oh, elderly, more than 60 years old. In Italy, they're young, really young, and I think in the US as well, So, so I'm 56, and I've seen a lot of patients younger than me dying in my hospital. So there was concern. My professor, when he asked me to go to ward, he said, we are all going to die. And when me and you, we will die probably the last, there will be no place in ICU for us because it will be full, So the situation was really dramatic, and every day waking up, the idea was really a weight on the stomach and saying, wow, I'm living in a nightmare. But then, you just open the window and see the sky and see the flowers. But even if you couldn't see, you just saw a wall, feel that you are living and that someone wants you in this life. And this is really what can make you happy. But it's difficult to say because it's not words. You can understand it. You were really right. You moved me, when you said at the beginning of this friendship, because it's only this friendship that can show you clearly. I don't know if you've read or if it's popular in the US, the book by the French writer Antoine de Saint-Exupéry, The Little Prince. Okay. But when he says to the fox, what I will leave you, and what will you gain in this, and the fox says, well, I will gain the color of the fields. They are all yellow like your hair. And it's just that in this friendship everything has a face and everything is familiar. And this is the most important thing. So I wanted to write that because at the beginning I saw that my patients, even the most concerned patients who were normally all fold on their disease, they were writing, how are you, doctor, every day, but not, like a lot of fathers and mothers, and saying, just concerned about me, about my health, and about what I was living. And they stopped really complaining. And so I said, well, there's something new in this. We are starting to see that everything is a gift. Like, as I wrote, like when we see as doctors, but maybe many can have the same experience, that when you pass a deadly experience and you risk your life and you return back to life, nothing more is given for granted. Everything is a gift. And you wake up in the morning and you say, wow, another day. And this is the most beautiful experience. But also at that time, it had also to do with the fact that for many in Italy, it was the opportunity to show them off. You go to the TV every day, your face is appreciated, you can say what you want, and all the country will repeat your ideas and so on. So you'll be popular. And one day with my wife, I was attending one of the very, very few mass we could attend. We went out of our region to find it. And I was thinking of that to measure your life on your popularity, you must measure your life on the years of your life. I don't know if it's clear this. To measure your life as a gift, and so to be able to spend your life and work and do every single part, even if no one ever knew what you're doing, you must feel yourself like a Turner, which means really loved by someone who gives you everything. So you don't have to show off who you are. You just want to understand who is the one who wants you in this world. And yeah, now also, because this reminded me of some words that a priest, friend of me and Andrea, Don Giussani, said once. He was talking about housewives, and he said, the angels of God will bend their knees in front of housewives because their sufferings and their suffering and all their deeds are not renowned in front of men. They are all done in silence, but what they do is really great. And this, is something that I still bring with me. And if I can explain it, it makes you free, because you are free from what can happen. If someone will appreciate that, okay. If no one will appreciate that, that's not a problem. It's not from that my life consists. Can I say that? Yeah. So also in this moment, we are spending a lot of energies on these discharged patients, but because with every one of them, there's a story that starts. And I got a lot of COVID friends. So I would say that before I came home with the ham and salami and wine from my HIV infected patients. Now I come home with the same things from COVID patients who come often from the countryside. So it's really interesting. But, you know, it's not for that. It's for the fact that no one asks them to do that. You know, it's just a friendship that starts. And this friendship means a lot of telephone calls every day. And, you know, how are you? What are we going to do? And so on. But it's part of life. And it's beautiful like that. Yeah.
Well, thank you for such a beautiful answer. We would like to now open the floor for Q&A. So all the participants are welcome to submit their questions in the Q&A box. And perhaps I could field first two questions that came in. The first question was, there's a sense from reading media reports that Italy is a few weeks ahead of the US in terms of dealing with the pandemic. What is your general sense as to how the US is, at its experience, US is dealing with the pandemic, and what would you hope to see in terms of the US's continued response to the pandemic?
Yeah. Well, what I see is on the one side as a doctor, and it's very important to me and to us, to all the world, is the scientific effort that we knew that we would see once the pandemic would reach the US. And so, you know, I can see that what I would say we have started in Italy, because at the beginning we really could not understand anything of this new disease, is now taken over and very, very well developed. Although we don't really have true answers to date, we still have some drugs that do something, but you know, the HIV infection has taught us that normally it's necessary to have an answer. Several years are required, so we cannot expect to have a quick answer. But just to know, you know, this is a false way, this is a better way, and so on. So this to us is very important. Trials in Italy are shutting down now. We have been for a few weeks looking for the last COVID patients to get into trials, but we couldn't really. Several times I went from Milan to other towns to find patients, and but you know, they were really not even true COVID patients. They were just swab positive, but their clinics was much different, so useless to study. So this is one thing that for us is very important. And in general, to have all this method and also power, let's say, from the US is generally something that you know, you feel more comfortable. You know that you're not alone. The second thing is that if I can say one really terrible aspect of this COVID is that it has generated, even in Italy, a lot of evil among men. A lot of people taking care of their own interest, you know, and you would say, well, in this moment, there's a country to save. You have to get involved with all your strength, and you're just looking at your belly. That's incredible, And so what I would really like to say and to know from the US is how people is putting in place solidarity, because this is very, very important. I haven't said anything about my wife and my family, but at this point, I really need to say that, because if there's something that I regret from the COVID period, but you cannot really do everything in your life, is that I was at my place, you say on the trench anyway, in hospital. And I could not spend that time with my family, because I saw that my wife had transformed my house in a small convent, prayer in the morning, prayer at midday, prayer late afternoon. And these were very, very important moments for all the family, because, we were really locked down. They could not leave our house. I only could leave my house, but for going to the supermarket and buy something, and let's say once a week. For the rest, they had to stay in the house. But in that, well, my three older sons were studying. And they knew they had very clear that their duty in that moment was to study and to go on with their exams, with their university, and so on. So no one of them was regretting the fact that they couldn't do this, they couldn't do that. They were happy in what they were doing. I could see it clearly when I came home. And one thing was that me too, I had to come home often very, very late, sometimes even at midnight. But I could see that they were waiting for me, and that they were really a beautiful family. And my youngest child, I would say of mine, not fostered, he's 20 years old. And with his friends in these surroundings, he set up a group of students. Probably also in the US, there may be many. They just went to the supermarket for elderly people who could not leave their home, or for sick people who could not leave their home. So we had some discussion at the beginning, because I had to tell them how to behave with sick people. So not to accept money, to use at least paper, because the virus is less enduring in paper, so it lasts 1 day and a half, while in a plastic bag it can last even 3 days. So I said, well, if you really need that, you just put the money in a paper envelope and you let it close for 3 days. So all these kind of suggestions. But then he involved his brothers, and all of them, they went for this solidarity with I mean, they had the authorization, and they could go and do that, and they did it for all the period of the lockdown. And it was really beautiful to see that everyone had his own place. No one was, losing time. And this is something that I would really like to know. I'm sure, because I really appreciate the US, and I am sure that there's a lot of good. So, one sad thing is that when you listen to the TV, you only get bad news. You get the news of the killings, you get the news of the riots, and these are they are true because they are part of our world. But really, if you couldn't have the news of all the people who's living, as I said about my family, it would be beautiful, because you know, you go on in life looking at what is good, not at riots. Riots is sad, and you can pray and say, well, I hope these things will stop sooner or later. I don't know if I answered to this question, but
Yes, that was
okay.
beautiful. Thank you so much. So we have a next question. What is your sense as to where the testing accuracy is going, and when it can have a strong impact in reducing the viral impact in our lives? How do you see this coming under control?
This is a very hard question. So let me just return a moment on the previous question, that just to say that what I was saying means that if you are living something good, please let people around you know. Don't be shy, because people need to know. Okay, so this. For on the virus side, I would say that at present there is a lot of confusion. Let's say in Italy, well, in the last month, we had in our hospital one woman, and we were very worried about that, who came in with COVID pneumonia, classical COVID pneumonia. She's on remdesivir. She entered the trial, but she's the only one in 1 month. So all the rest is probably residues of virus in the throat or in the nose. So that is what moved me this morning to try for hydrogen peroxide. And I don't know what other ways we can have to help people to clear out the virus. But numbers are slowly reducing in Italy. What I said at a certain point of the COVID in Italy just before Easter is that I was seeing really that the situation was too heavy for a lot of people. I have a friend who takes care of all the handicapped and psychiatric patients and alcohol addicted, and she told me, she said, you don't know how suffering there is around, because your family is a normal family, but if you had a psychiatric relative in your house breaking everything from morning to evening, how could you imagine to stay with that person for closed in your house for 2 months? Sooner or later, someone will die. Sooner or later, either there will be a suicide or a violence. So we have to stop this. And so I said, okay, I will try to write a letter, which never reached our politicians. But the letter was, okay, we are doing all that we can from the medical part, but we also need the help of the police. Sorry if I say that, but it's really true, from the police and from the army or anything similar, because I think that you cannot just go on the goodwill of people. You also have to say, okay, this is something that we have to do. So everyone has to do it. You cannot withdraw yourself from this battle, because you are not alone. And I think that this is still absolutely lacking in Italy. In Italy, we had really none of this. I crossed the town of Milan every day in 2 months. I never got stopped by the police. So never been checked, and not because I have a big cross on my car. I have no cross on my car. So it's a normal car as any other car. So, but I have never been stopped. And this is the experience of most around me. So Yeah.
Well, thank you
Sorry.
so much for that. We unfortunately have ran out of time and have to wrap up. So I like to take this opportunity again to thank Dr. Amedeo Capetti, who's joining us from Milan this evening, as well as his good friend, lifelong friend, Dr. Andrea Mariani. I mean, for taking this, time away from their very busy schedule, and sharing their first-hand experience, and just giving us a lot to think about. So before we wrap up, I'd like to make a brief announcement that our next webinar will be held in exactly 2 weeks on the July 8th at 3 p.m. It'll be led by Professor Ed Gomez on the health politics and policy in response to the COVID-19 pandemic. So we hope that you will join us again and ask us a lot of questions. Again, we thank you so very much, and on behalf of the panel, thank you, Dr. Capetti and Dr. Mariani.
Thanks to you. If you
Thank
come
you
to
for
Italy, you
joining
are
us.
welcome. Okay.
Thank you. Bye-bye.
Bye.
Goodbye. Goodbye.